As ENT surgeons, we deal with nasal obstruction every day of the week. One of the most common causes of nasal obstruction is a deviated septum. What is your septum? The septum is the midline struct between the two sides of your nose, between the left and right nose. It's a bony wall in the back, and at the front of your nose it's a cartilage wall, and it may be deviated due to trauma, or maybe it's just the way you're born. Whatever the case, a crooked septum can really impinge on your quality of life. The nose isn't just this thing on the top of the face here. It's a bit like an iceberg. This is the bit showing above the water, but most of your nose is actually inside your head. If we have a look at this guy here, I'll push this back to the back of his nose. There's that much space to the back of his nose. There's that much nose that you don't see. And often problems with the septum can lie within. So you can have a straight nose from the outside, but a crooked septum on the inside. But if it is deviated, it can give you nasal obstruction, and this can really affect your quality of life. Not just blocked a little bit, total nasal obstruction can drive patients crazy. It can affect your sleep, it can make you snore, it can make exercise difficult, it can affect your mood. And of all the operations I do, fixing the septum makes my happiest patients because it's a simple, safe procedure, it's a relatively seamless recovery, and the results are fantastic. Being able to breathe absolutely makes patients so happy. We often tie in other surgery or problems with a deviated septum, and these often entail treating the sinuses. Now, what are the sinuses? The sinuses, you can see, are these caves, this honeycomb pattern that lie within the facial bones, between the eyes, within the cheeks and in the forehead. They obstruct easily, and this results in sinusitis. It can be acute severe pain, it can be chronic facial pain and recurrent infections that require antibiotics again and again. You don't have to live with nasal obstruction, you don't have to live with recurrent sinusitis. These are simple, safe things to treat, and if you have these symptoms, make time to speak to me about it.